Hello, everyone. Today, I'm very, very excited to introduce you to Dr. Julia Huber. And Dr. Huber, thank you for being with us today.
Thank you so much for inviting me. It's a real honor to be here.
Well, Dr. Huber is a lifestyle medicine physician and trauma-informed coach. She launched a telemedicine lifestyle medicine practice in Lexington, Kentucky in 2021 after practicing emergency medicine and occupational medicine for over 20 years. Now, this is a new genre or offshoot of traditional medicine. Can you tell me exactly what is a lifestyle medicine physician?
That's a really good question. And I think it's interesting that we kind of call it an offshoot, because in some ways it is, and in some ways we're actually coming full circle back to what's possible in the realm of traditional or allopathic medicine. I am board certified with the American Board of Lifestyle Medicine, and the training I received is through the American College of Lifestyle Medicine, and they have a very succinct definition of lifestyle medicine that I'm going to share with you, but then we'll kind of talk about that a little bit because I have my own way of practicing it.
Right.
I think it's really helpful to delineate what it is because I think it's a term that's used fairly loosely. I think a lot of people, because they're dealing with lifestyle, call themselves lifestyle medicine physicians, but these parameters are very, very straightforward if you're a diplomat of the American Board of Lifestyle Medicine. So let me just read this definition and we'll chat a little bit about it. Maybe you've got some questions.
Okay.
Sure. So it is defined as the use of evidence-based lifestyle therapeutic approaches such as predominantly whole food, plant-based diet, regular physical activity, adequate sleep, stress management, avoidance of risky substance use, and other non-drug modalities to treat and often reverse and prevent the lifestyle-related chronic diseases that are all too prevalent. So that's it in a nutshell. And that's why I'm saying that if you think about it, in many ways, that's why the patient will go to a physician. They've got chronic disease and they want to know from their physician, how am I going to deal with this? A lot of times they're given a prescription, which of course is appropriate, and they're given guidance too, particularly the primary care providers will provide guidance. But I think where lifestyle medicine helps connect the dots between what is really good practice, what physicians would like their patients to do, and what patients might really want to do, how to connect those dots between what's really done when they go home is in the realm of lifestyle medicine. It's really hard to connect those dots. Research studies have shown that if you just kind of tell people what to do, give them instructions, they're just going to go home and maybe some of them will do it, but the rest will be a little bit perplexed. They might not know how to start. They might not be ready. They might have a lot of other things going on that make it difficult for them to start with lifestyle change. And this is where a specialist in lifestyle medicine can step in. So just want to divide these components a little bit. We call them the 6 pillars of lifestyle medicine. And I could probably talk for an hour about each one. So feel free to interrupt me if I start going off on a tangent because I get really excited about this. I wrote down a couple of words that for me have a little bit more meaning. Now they talk about evidence-based. And I think this is where lifestyle medicine is really interesting because in some ways it's cutting edge because we're not going straight to the medicines as a 100% cure, but we're looking at what research studies show. And that's where physicians, this is our wheelhouse, this is where we're comfortable. We're scientifically trained. We want to know what the evidence is. What do the research studies show? What's interesting is that a lot of the research studies show that changing your diet, such as even reducing the types of animal fats you're consuming, increasing your fiber, really eating a plant-based diet, the classic eat a rainbow, that's so prevalent. Even heading towards that can help reverse chronic diseases. Having a higher higher weight than might be healthier for you, um, reversing or at least trying to mitigate high blood pressure, high cholesterol, diabetes, all these things that we know lead to chronic issues that ultimately make people pretty miserable. A lot of these
You said evidence-based,
Mhm.
and what's so confusing to people, I believe, is that there's evidence-based things for lots of different ways to have nutrition in your life, because you'll find that a high protein, low carbohydrate diet, there's evidence-based uh, that you can lower your body weight, you can lower your A1C through
Mhm.
a diet like that. And then I can turn around the next day and read evidence-based uh, that's not exactly correct. So I think people, patients, the people who are coming to see you or trying to work with you, they get confused by what they see on the media or what they read, because
Mhm.
it's very contradictory from time to time. So
It,
that's why we
mhm.
use you, so
Mhm.
that you can guide us on what is truly evidence-based, and then what's maybe the fad, or the what's kind of the flavor of the month, so to speak.
I think you're absolutely right. I think a lot of times, a lot of diets are presented, and I think of them as kind of like hemlines. What's the latest fad? And I think what we want to look at in terms of lifestyle medicine is really working with patients so they can make it through the long haul. I think there are a lot of diets that will allow you to rapidly lose weight. And then you can look at what we call the endpoint and say, hey, in 2 months, people lose this much weight. But what you also need to look at is, did they gain it back? Did you look at them years later? Um, and also, is this something that they can live with? I mean, I think a number of us, I know particularly women, I know that I qualify, in my 20s, I was a weight that I didn't care for. I would say, bordering on classic obesity. And I tried different diets, but it's really hard to find something that's really long lasting if you're miserable. Are you going to eat raw tofu and rice cakes and nutritional yeast for 3 meals or that type of thing? And I'm kind of laughing, but there was a point in my life when I was, following a very radical diet, and I was miserable. So when I tell people about lifestyle medicine, there are these extremes, and you can look at the whole food plant-based diet, and that really is the standard right now, where we found that you can actually even, and they're very bold in the American College of Lifestyle Medicine, where they look at even reversing disease. But the question is, how do you connect those dots? And that's where someone like me will come in, because you can't just kind of look at people and say, well, I don't ever want you to eat a burger again, and I'm going to like toss away all your chocolate, and, it's all just got to go. Um, because that's not realistic. A lot of times you need to assess really so many aspects of what people are doing in their lives. Who's preparing the food in the house? What types of diseases do they have? Because I think a lot of times people get started on these radical diets. And you said, for example, like the high protein. Well, what if their kidneys are a little bit slow functioning? You might actually hurt someone or hurt yourself by going on a diet that's so radical that maybe you're losing weight, but perhaps you're even hurting yourself. I think we need to be kind of very careful about that. I think where our strong suit is really looking at what evidence we have in front of us right now. And I think that's hard for people to understand sometimes, is that when we say evidence-based, I mean, the evidence that we have, that society had, in Europe, maybe 700 or 800 years ago, was that the earth was flat. That was their truth. You know what I mean? And then once you get more information, that quote evidence changes with more evidence. So I think it's really important to say, okay, maybe that worked 5 years ago. We've got some new studies that we can look at. How can we kind of adjust that? Yeah, and the other thing that I like to talk to people about is that it's not just about the food. I think it's really trendy to look at lifestyle medicine in terms of food. It's got a lot of, I almost want to say the word is visual appeal. You can just do, it's easy to do a lot of photos of food and kind of concentrate on that. But I think the extreme end of that is an extreme focus on food to the point of feeling like you can't eat anything and taking rules books out and getting kind of mired down in rules. And I think it's important to look at working directly one-on-one with a patient so that you understand their context. You understand not only their health history, but what we call their social history, where they work, who they're connected to, what brings them meaning, what brings them joy, what gives them purpose, what they're living for. Once you kind of pull together the patient's narrative, you can get a better understanding of what their needs are and what's realistic. So a lot of times these are guidelines. And I emphasize guidelines because I think and I know what distinguishes a lifestyle medicine physician from a traditional allopathic physician is that we're collaborating very, very strongly with the patient. And that's where the coaching end comes in, where rather than saying, you've got this problem, go do this, which is in some ways, for lack of a better word, maybe paternalistic. We say, here's the information, and let's look at what's important to you. Here are a couple of options, maybe a couple things you haven't thought about. And how do you want to move through this? We can take a period of time, which is reasonable for a period, and see what works for you. And then we can revisit that. And if that doesn't work, where do we need to tweak it? Where do we need to adjust this? So it's something that you can do day in and day out. In other words, when I coach people, my goal is to fire myself. My goal is for people. Does that make sense?
Yeah.
My goal
if they're doing a good job, hopefully they don't need you as much.
Exactly. I will feel like I've done a good job when people say, I don't need you anymore, right? Because they've got the tools that they need to be able to make informed decisions based on what they know now about themselves, their needs, their bodies, how their bodies respond to different types of environments and conditions. There's some flexibility there, and they know where that flexibility is. And this gives people agency. And this is critically important in terms of really being well. Because if the motivation comes from the outside, it's going to get just this far, and that's going to float away. And where a lifestyle medicine physician and a coach can be of assistance is to really help you kind of look at what's underneath the choices. I'm not talking about psychotherapy. If people need psychotherapy, again, we're talking collaboratively, and sometimes they do, then we refer out. If they've got a very complex medical condition, they may need a nutritionist. They may need a cardiologist, for example. So that's where we kind of collaborate. But I do want people to leave with a skill set that allows them to make conscious, healthy decisions that reflect and are aligned with their deepest values. That's the coaching side of things. And I think that's an important thing to understand because, again, it's not just about the food. It's about how you perceive your ability to make conscious decisions and changes in your life that will impact your life.
Well, I'm intrigued by this because I feel that in today's medicine, people go see their physician and they would like to have a conversation with their physician.
Yes.
And we all know now that because of the way things are, physicians don't have the kind of time that they would probably like to spend with their patients. So their patients gets a little bit of time. the physician gets a brief synopsis of what's going on, and then they make a quick recommendation and send you on your way. I've always said, if I could have a physician that I could actually talk to and let them understand what's going on in my life, because there's a lot more going on maybe than just a symptom or a disease manifestation in a person. So I think what you're doing is not only is it the cutting edge or the newest aspect of medicine, but it's probably what's needed right now, is because people just feel like there's just too much stress. There's just too much pulling at them in every direction, and they don't get to really have a conversation with someone like yourself who can assess the whole person. And I think that that's what you're basically telling me, that what you're wanting to do with your patients. So how do you interact with them? Is this sort of like how you interact? You'll have this two-way conversation and kind of get a better understanding of who the person is that you're trying to help?
Absolutely. And, I'm getting a little bit choked up because what you were just describing really hits the nail on the head for me. I love reading literature. I love reading poetry. And I love knowing people's story. It's just infinitely fascinating, and it's all woven in. It's your narrative. We each have that. It's absolutely fascinating to discover that. And it does take some time, and it does take some effort, and it takes a little bit of courage too on the part of the patient. So it's not something that can happen in just one encounter, because there needs to be some trust built there. And I do have training in what's called a trauma-informed approach, both as I've had training as a yoga instructor in the trauma-informed approach, and I've also had professional training as a coach in trauma-informed professional coaching. And I think that's really critical for people to understand, is that when you connect with me, we're going to connect in a very, very safe way. I know that even recently I went to the doctor, and I don't know how many different people I had to interact with and tell my junk to, intimate stuff, filling out questionnaires and sending stuff off to wherever. And it's a little bit stressful. When people contact me, they contact me, just me. They can send me an email. They can look at my website, kick me an email. We'll set up a time to talk. I talk very briefly with people, maybe for 10 to 15 minutes for the first encounter on a televideo site. It's just kind of a quick meet and greet at no cost to them, because I want them to be able to ask some questions and kind of make a decision. Is this someone that I really feel comfortable working with? Because the types of intakes that I do are very, very intimate. And I want people to feel kind of like at gut level that they're comfortable talking with me. And I also want to know if maybe there could be somebody else who might better help them, because I want to help the patient. And if I feel like I, as a lifestyle medicine physician, cannot help the patient adequately or fully, I'll refer them on. I'm very happy to do that, because I want what is best for them. So I really don't want people, paying for a 1.5 hour intake, and then I say, I really think you need, a nutrition psychiatrist. And at the end, I may say, I can help you in this way, and then I'm going to refer you to a nutritionist or a psychiatrist, and we'll all work together. There may be that option. But I do that first conversation too, so everyone can feel really comfortable. I want them to feel safe. Then after that, we set up a confidential telemedicine video appointment. And the initial intake takes close to 1.5 hours. And we may have to do a second intake too, because I really, really want to hear their whole story. And some people have really long, complex stories. And we need to listen to that, because that has a deep impact on their health and well-being. And a lot of times people have been so, I can't think of a polite word for it, but they just feel so jerked around by the system that there's a lot to talk about, but I'm very thorough. I do a complete medical history. We're going to review all of your medications. If you've got some medical records I need to review, we'll review those. But then it gets a lot deeper. I go through the 6 pillars of lifestyle medicine and ask a lot of questions about that. We're going to look at stress levels. I'm going to have you keep a sleep journal. I'm going to have you keep a food journal. We're going to look at who's important in your life. Who are you connected with? And when I was reading that definition from the American College of Lifestyle Medicine, the ACLM, they talk about risky substances. That's kind of their focus, primarily tobacco, alcohol, that type of things. And I really expand that a lot. I actually have a database where I can key in the different, I can even take information on the top 5 or 10 like skin, cosmetic, shampoo products that you use and get kind of a reading on how those can influence your health. And for people particularly who have, a lot of allergies, sensitivities, migraine headaches, autoimmune disease, that type of thing, this is important information. So I expand that. So I love being on televideo because it allows me to create that intimate space, that container between me and the patient that is, I think, very, very safe. They're in the comfort of their own home. They know they've got a really long time to speak directly with me. Nobody else is going to ask them the same questions 5 and 10 times and 5 and 10 times. It's going to be me. I may ask the same questions 5 or 10 times because I want to get some more information, but they'll always be speaking directly with me. So this is a one-on-one, very intimate relationship that I love having with people.